there is a perception that in psychiatry it goes diagnosis, drug, come back in 6 months. And possibly because that's actually, you can't do much more than that in those kind of circumstances. And what I would like to see is somehow a way of bringing psychological and psychiatric approaches together in a much more integrated way. And I think just having two professions side by side doesn't actually cut it. In fact, it doesn't kind of work. So I mean, a good example would be something we've been talking about in terms of therapeutic relationship. If you look at inpatient psychiatric wards, I suspect you'll agree with me about this, but I think the common perception is that acute psychiatric wards are basically not very pleasant places.
They're not.
And there's not much humane going on, really. People are contained. And one of the things which I'd like to see is a sort of principle that everybody who works on a psychiatric ward should be able to be capable of engaging with the patient in a interested kind of empathetic way. And sadly, I don't think that happens. So there's a sense in which it seems to me that at the moment what happens is we have, you have medicine and you have psychology. The psychology is kind of an adjunct to a large extent.
Yeah, it does seem to work a bit like that. We should all be pulling together against the outrage that only 13% of the NHS budget is spent on mental health services and only 5% of the UK research budget is spent on mental health research, compared to 13% of the years lived with disability or 29% of the DALYs. I mean, that is the common rallying point or enemy. And in a way, I think the way we have been, and more hopefully less balkanised, is a reflection of our low status, and I think coming together to kind of take on the powers that be that demand changes to these kind of wrongs is going to bring us closer together.